Most people know what to do when flashing lights and a siren appear in the rearview mirror. But how prepared are citizens when the siren stops at their door? Do you know CPR? Clark County has developed a chain of survival to help resuscitate cardiac arrest patients. The chain begins with someone recognizing the signs and symptoms of cardiac arrest and calling 911.
Your most critical time in a cardiac arrest is that first 4 minutes. If we can get CPR begun and an AED on the patient in 4 minutes, we have a very good chance that that patient will survive the cardiac arrest. We've been proving that over the last 2 years with for ventricular fibrillation, which of course is the most treatable form of cardiac arrest. We have in Vancouver about a 48% survival rate. We mean survival now that that patient ends up becoming alive to the hospital and leaving the hospital in good neurologic condition. Many of them walk out on their own power.
Once the call is made to the 911 call center, trained emergency medical dispatchers send help and are prepared to provide life support instructions over the phone.
At the very beginning of the call, when we determine the location of the incident, find out what the problem is, when we ask if the person's conscious and if they're breathing, if the answer to those is no, then the call is immediately sent to dispatch. So another dispatcher usually is already dispatching help right at the very beginning. This allows us to, as a call taker, to continue helping the patient and delivering care while a different person in the room is dispatching help the entire time.
Fire agencies and ambulance paramedics are dispatched simultaneously, and when they arrive, continue CPR and early defibrillation. Emergency personnel receive extensive paramedic training with various types of life support equipment, so they are well prepared on an actual call.
There are several levels of training that firefighters get. There's an emergency medical technician training, which is where you learn to do CPR and mouth-to-mouth resuscitation, and in particular using bag valve masks to do respirations instead of actually doing the mouth-to-mouth, as well as some basic first aid type of training. Paramedic training is far more advanced than that and provides not only for the CPR and defibrillation, the electrical shock that you give to the heart to shock it back into life, but also the ability to put a tube down through your throat into your lungs to provide air, oxygen into your lungs, to administer medications to get your heart pumping again.
The ambulance paramedics, together with the fire EMTs, provide the patient with advanced cardiac life support. If necessary, the paramedics can continue support in the ambulance en route to the hospital.
Actually, they can perform all of the tasks that they would normally do on the scene while they're in the back of the ambulance. They're really set up like a small emergency room. There's a few things that we like to get done before we start moving the patient, but once those are accomplished, then we'll continue with the treatment. We can do defibrillation, establish the IVs, give medications, everything that essentially would be done initially in an emergency department.
Clark Regional Emergency Services Agency has new digital equipment that will help locate the nearest emergency responders.
We do have a new computer-aided dispatch system that we've installed. That system enables us to use GPS information on response vehicles so we can identify the closest vehicle irregardless of what department they might be in. It also allows us to use the police departments that have AEDs in their cars. If they're close to the scene, then they would get dispatched automatically to cardiac arrest patients as well.
While it is important for various emergency agencies to work as a team, it is essential that citizens maintain current CPR training in order to offer immediate assistance in the chain of survival.
Family members need to be trained to recognize symptoms, symptoms that might precede a cardiac arrest, recognize when a cardiac arrest has occurred, and then be able to trigger the 911 system quickly and to start basic CPR. It's a fun course actually. It's a 1 hour session of learning how to do basic CPR.
For more information about CPR, contact the American Heart Association at 1-800-242-8721 or heart.org. For information about the local emergency medical system, please call the Clark Regional Emergency Services Agency at 737-1911 or ems.cresa911.org.